Thank you so much. Thanks everybody for joining us, and thanks everyone listening in. My name is Wendy. I lead a team at Alexion focused on patients and caregivers and really bringing those insights into all of the work we do. And for those of you who thought you'd see Megan, I deeply apologize, and I'm substituting for her today, but we'll have a great conversation. We're going to start with some introductions. I'm going to ask each of you to introduce yourselves and tell us something about you not related to your caregiving journey. Why don't we start with you, Dan?
Hi, I'm Daniel DeFabio at Global Genes. I'm Director of Community Engagement. I'm dad to Lucas, who had Menkes syndrome. And something unrelated to all of that, lately my family is mocking me for falling down a prog rock rabbit hole. So any musician who ever played with King Crimson, I'm doing a deep dive.
We need to learn more. Bret?
Awesome. Hello, everyone. Before I start off, I always like to give a shout out to all the caregivers in the room. So if you're a caregiver or supporting a caregiver or caring for yourself, thank you for all that you do. You are awesome. We don't always get the recognition we deserve, but understand that people are with you and understand how hard it is. So thank you. My name is Bret Koncak. I'm the co-founder of a digital health company called mejo and also the father of 2 rare disease kids. During the presentation, I'll tell you a little bit more about mejo, but the idea is to really help with activities of daily caregiving and improve the life of caregivers, and that will be some of what we share here today. My unknown, unrelated fact to caregiving is that I ended up being in healthcare technology for 20 years, but if I wasn't going to do that, I really wanted to be a chef. My only problem and issue with that is I'm pretty sure I'd never leave the kitchen if that was the case. So happy to be here with you all today.
Hi, everyone. I echo Bret's welcome and just thanks to all the caregivers. I'm glad to be part of a session focused on you. My name is Bridgette Kelleher. I'm an associate professor of psychological sciences at Purdue University. I am a parent and caregiver to children who have neurodiversity, but not rare disorders, and I want to make that known. I'm here today because I'm PI, meaning I lead a clinical trial focused on how we can select the best caregiving supports for rare disorder caregivers. So I'll be able to speak on that today. My research really focuses on how we can use technology to best understand the needs of families and then design the appropriate tools and supports to help them. So I guess my unrelated fact, maybe this is slightly related. I'm a parent of 5 children, 2 are Girl Scouts, and we're currently training our dog to pull Girl Scout cookies through campus this year. So we're training for upcoming events.
That is amazing. I thought it'd be really important to start with a little bit of a glimpse into the other parts of our panelists' lives, because caregiving becomes all-consuming and really part of the identity, but at the end of the day, each of these amazing people are people that have a lot to bring to the table, so thank you for sharing. I'll share a little snippet. I was the #1 cookie salesperson for Girl Scout cookies in the state of Ohio one year, which was great till a literal semi-truck pulled up in front of my house to deliver the cookies that we then had to get to everybody that bought them. I thought my parents were going to murder me. So that's a little of that.
I'll get tips later from you.
So we're going to dive in, and I have a couple of questions to start the conversation, but we're really going to follow this organically with where the panel wants to go, because they're the best able to determine what we all talk about today. But in a discussion prior to this, we did align on a few key themes. Being a caregiver creates so many sudden, urgent, unexpected priorities outside of your control. Daniel, we'll start with you. What types of barriers to your own self-care does this bring into your life?
I think the overwhelming burden, load on you feels like you can't take on one more thing, and so that one more thing is often your own self-care. And I was the person, and I've heard it from so many of you, that that's the one more thing we just can't take on. And then I'm sure you've all heard why you have to work against that. You have to make the time for that, and you can't pour from an empty cup. And if you break down, the family breaks down. And we all have probably heard that, but implementing it is so much harder. And I was actually, this isn't the first time I've talked about this, so I've been talking about this for years and not taking my own advice. And I remember a time that going to the dentist for me, literally someone drilling my teeth was a respite. It was a beautiful little mini vacation. And I think we'll probably get into it more. The self-care topic is a little tricky and misleading. We've all heard that it's not a spa day. It's not a big girls' weekend trip. It can be all these little things. And just recently in Kelly Coleman's great book, What You Didn't Know About Raising a Disabled Child, she has a line in there that struck me so well about self-care that is, just make sure there's something on your calendar for you that you're looking forward to. And that, I thought, made it so much more manageable and easier to embrace. So I guess that would be some of my thoughts and tips.
And then Bret, adding on to that, when you think about self-care from maybe a perspective of easing the schedule almost, how do you think about technology in that way and how you bring self-care into your experience?
Yeah, I think a lot of caregiving is around the context switching, right? You're wearing so many different hats. You're a person administering the treatment. You're a researcher. You're trying to learn about it. You're trying to connect with the community. You're trying to coordinate care. There's a financial aspect. There's new equipment that you're learning about, all of these things. And really, when we talk about technology, it can be such an enabler to help with a lot of those different things, especially now. If anybody's jumped into the world of AI and those different things, there's a lot of powerful tools that you can use to go help you learn and to really even almost have a conversation to help you think about thinking. And so, I'm a big person and you'll hear me say this throughout, and it may apply to you or not, but just kind of mental models of things that you do to kind of help you with whatever you're dealing with. And so when it comes to balancing all of these different hats and all these different things, a phrase I like to tell myself is there's some things we just have to put on the shelf for a little while. And I'm not able to get to those, and I need to go prioritize something else in my life, whether that be myself or my other children or something else that's going on. And I can come back to that thing, but it doesn't have to be all consuming all the time. So I think it's figuring out what are those different things that work for you, and then using technology to help you with those different things, whether it's gathering knowledge, whether it's coordinating and centralizing information, giving yourself the freedom to forget. Can we imagine the ability to give ourselves the freedom to forget, knowing that we have it somewhere else, that something else has our back? And that's one of the things technology can bring to the table.
It's pretty powerful, and I love the concept of having something that can help think through the thinking. That's really amazing. In your work, Bridgette, when you listen to some of the comments they've said, how does that apply to the work that you're trying to drive from a research perspective?
Absolutely. Well, technology is important to what we do. So my research focuses on technology, how we can use tools like smartphone-based assessments or telehealth to remove some of the barriers that many of you experience. So as I'm listening, the barrier that came to my mind that we're seeing in our research is isolation. And so I use a technique, to use like the fancy science term, called ecological momentary assessment. So if any of you have been in our research studies at Purdue, we send questions to participants' smartphones as they go about their day to ask, how stressed are you right now? What are you dealing with? How are you coping? We've been doing this since April 2020. We started this during the COVID-19 pandemic and have continued it now in clinical trials to try to use those data to personalize these support programs. What we saw during COVID, I'll never forget, on any given day, about 20% of families in our study, when we said, did you talk to another grown-up today, said no. They were completely isolated. They were alone with their children. They were wearing all the hats. I really think that became a big barrier that then springboarded the next phase of our work, which is how we can do telehealth-based support programs and design tools and technologies that can bring down that barrier. So I want to bring that up early in this. If you feel isolated, even though you're here in a room with all these other wonderful people, especially folks at home listening, you're not alone in that. And that's a huge barrier that a lot of families are continuing to experience even after COVID.
And then Bret, what do you personally rely on for actual stress relief? Because some of what you just described, even in just juggling and keeping those all the balls in the air, particularly with a bigger family, how do you personally find stress relief, if that's possible?
So I think there's a few things. The easy answer is exercise. It's hard to find time to always exercise, but for me personally, if I'm able to get that in, that's really important. I think a lot about trade-offs. So when I'm involved in some activity, talking to an insurance company might be an example. It doesn't feel like the best use of time versus being able to do something I really enjoy with my kids, like playing basketball or playing a board game. So I'm always looking for what's a shortcut for the activities that I don't feel are a good value of my time but have to be done so that I can create more time doing other things. So I'm always trying to look for what are those things that I can go do? How can I prepare in advance? Care coordination being a big one, right? I just always assume no one talks to each other. So that means I'm going to go kind of line up stuff the way that it needs to be lined up to try and make it as effective as possible. And if I do that, then I can prevent some things from happening, and then that gives me more time back. So I'm always trying to bank extra time and be able to use that for things that I enjoy, because I know that that kind of gives me energy to go forward.
You mentioned, Daniel, the dentist. Would never, honestly, have never considered that being a respite from caregiving, but I get what you were trying to say. I happened to have a conversation with a friend of mine who's a rare disease caregiver, and she said her dentist fired her because she had missed so many appointments, and this was for her own dental care, and she was mortified. So in that context, how do you think about sort of the social rules around how we're supposed to show up when people don't really understand what's going on in your personal life?
Yeah, it's going to affect everything. The norms, we know they go out the window. The norm of medical care doesn't apply anymore, so we get into the specialized medical care. And the norm of your parenting life, if you're the parent to a child, or if you're the direct patient, then it's your personal life, is upended by the diagnosis. But you don't necessarily immediately realize the difference between what could be normal parenting, typical parenting, and parenting plus caregiving, and that's extra burden. So finding time for any of those things and the expectations that you mentioned as, why can't you come to the thing I invited you? And of course you want to, and you've said, I have said no so many times that I get not fired from my dentist, but fired from my friends. They stop inviting you, and you really, I'm sure many of us have done it. You want to keep inviting me. On the 28th time, I might say yes, or the 94th time, I might say yes. But it's really difficult, I think, to manage this new lifestyle and schedule. And one thing I found was I literally published my schedule, my care schedule for my son, on a blog so that my friends could see, if you're inviting me, it better be between 2:30 and 4:30 in the afternoon. That's the only time I've got. And there's never more than a 3-hour window, so don't expect me for more time than that. And that actually helped. There's actually a friend of mine, a neighbor, here today for the first time at a Global Deans Conference, and she was one of the few people, she read that blog and she invited us at 3 o'clock. And I said, it's amazing that you chose 3 o'clock. It's the only time that works for us. And she says, I know, I read your blog. So I think the point there is that if you, I call them one-sheets, and that's actually the reason I know Bret and his partner Ryan at mejo is I was advocating for these one-sheets, and they turned it into not paper one-sheets, but digital one-sheets in an app. The more things you can have at the go, like your schedule, or your list of meds, or your list of surgeries, or your caregiving needs for a babysitter, should you be lucky enough to get a babysitter. All those things at the ready will save you some time, and it's much easier to do them when you're not in crisis mode. So I call it front-loading the work. Nobody wants to do the work until you have to, but the moment when you have to is going to be harder than if you did it ahead of time, and hopefully it's reusable and repurposable, so you're saving yourself some time and effort.
So you just shared so many powerful insights. For those of us who are friends and loved ones of caregivers, the idea of understanding without having to ask what your time schedule looks like so that we can fit that versus you trying to fit another schedule, I think is really powerful. But I also heard in there, keep asking, keep inviting, don't walk away from that, even if your answer is no for all the right reasons, so thank you. The one-sheet concept, Bret, how does that kind of thinking impact you and your role as a caregiver?
Sure. So, when it comes to rare disease, the default is to go to kind of complex and comprehensive. And there are certainly areas that require that complexity and that comprehensiveness, especially around research. But there's a lot of day-to-day life that doesn't require that much. And so being able to kind of offload some of that into something that's simple and useful can be really powerful. And what we've heard kind of families across the US tell us is that's actually kind of 80% of their interactions. The school doesn't need to know everything from day one, every lab, every procedure. They need to know what's going on now. Grandma comes over and is helping out. She needs to know what's going on now. A therapist kind of wants to know the latest information. So this idea of generating readable one-pagers of that information at a glance can be really powerful. And then the savings really add up. So when I talk about kind of banking time, it's 10 minutes here, it's 5 minutes there, it's 10 minutes here, it's 5 minutes there, is then 30 minutes watching my daughter's favorite show with her, because I've been able to bank that time. And so it's kind of a mindset shift, because you're dealing with so much complexity and learning coming at you. And then you talk about the four walls of healthcare, right? They go down to the nittiest grittiest detail. But being a daily caregiver is usually a little bit higher up from that. And you can use different things to allow you to access that information when you need it, repeat it, and kind of take those things off the plate, which can be really powerful. And then you can go really deep when you need to go deep, but that's not the case in every scenario.
So, Bridgette, from your expertise perspective, even outside of your study, when you hear both of them talk about reducing stress and caregiving, what strategies resonate with you that could be applicable for everyone?
Yeah, this question of stress is really interesting, and our team's been meeting a lot lately talking about this. So one really cool part of our clinical trial is that we have 8 rare disorder caregivers, paid staff on the project, and they help us interpret data that's coming in and make sense of it, make decisions based on it. And we designed the trial in a way that halfway through, we could stop, look at the data, talk with the communities about it, and then make some decisions. So we just had that meeting a few weeks ago, and this topic of stress came up over and over and over again. And one consistent theme that I'm seeing across all of our studies, and these started, our first kind of caregiver support intervention we launched in partnership with the Angelman Syndrome Foundation in 2020. We've done 3 different clinical trials since, working digitally with caregivers and developing and deploying evidence-based treatments via telehealth and seeing what's working and what's not. And when we got the first data back, I was like, I bet we're gonna see that, stress improved and these things. A lot of great things happened across these treatments. Stress in these communities does not necessarily change. You all are dealing with persistent, continuous stressors. And when we saw that come up study after study after study, these beautiful kind of support interventions like apps and one-pagers and all of that, that can reduce the actual stressors, but there will be things that cannot be changed. And so I think when we think about stress in rare disorder caregivers, we have to look at how do you then cope with the existing stressors that can't change. That it doesn't become changing the stressor always. It can. There are things you can do to modify that. But what can you do in the face of kind of uncontrollable stress too? And what tools can you bring to your toolbox? And right now I have our postdoc on the project is presenting at the Prader-Willi Association, a poster where she looked at what were the coping mechanisms that folks endorsed when we asked them throughout their day, how are you managing the stress in your lives? Again, we're asking folks this 3 times a day as they're both preparing for treatment and going through treatment. The number 1 coping mechanism that folks endorsed was keeping busy. It was by far the most popular, and that made total sense to us, right? Many of you are in situations where you're constantly busy. There's no time, there's margins, you're fitting in 5 minutes for yourself here and there. What we noticed was folks often don't have other tools to kind of manage the psychological burden other than keeping busy. And so, working with licensed providers to help you develop tools in your toolkit, like mindfulness activities, which might sound totally, unmanageable given the stress load, but knowing that those psychological tools that you can develop through therapy and support programs, those are often really important to complement the reality that the stressors can't always change, and that keeping busy won't help you necessarily feel better in the face of these persistent stressors. You need other tools too.
Thank you. Bret, I would gather, knowing you, that people in your life genuinely want to help and that they come to you with offers of help. Data shows that caregivers, particularly in rare disease communities, most often turn down such offers of help for a variety of reasons, which we won't really have time to dig into. But what worries do you have, and what do you hear from your community about accepting offers of help?
Sure, it's hard. I'd like to start with a story. So both my sons were in the ICU just a few blocks down at Children's Mercy Hospital, and they went from climbing trees to being a shell of themselves in the ICU. And so when that happens, family and friends reach out to you and say, how can I help? How can I help? and you're just struggling to survive. You can't even give them ideas. And somebody must have been in the situation before, because they sent wool socks. And if you're in a hospital, you know it becomes freezing cold at night. And having warm wool socks is incredible. And so I think about this a lot when we talk to folks around how I can help. And it's really about that these individuals are just trying to come up for air. And so to put another burden on them, to ask them what to go do, is just extra stuff on top of everything else. And that's why things like Meal Train are great, because it just kind of handles itself and people bring you meals, and that's something that everybody knows and loves. And I think it's really about, in most cases, this is family and friends that understand you, and so they understand what things may have been kind of typically before a major incident or during. And so I just encourage them to just offer to do specific things. Can I pick up your kids for the day? Can I go take them over here? Can I go bring you dinner? Can I go help clean your house? I remember sitting in the ICU, I was like, where's the pause button for life? Because all this stuff is going on and they don't care that I'm here in the ICU. Bills are still coming. House chores are going on. I have practices to get kids to. No one else cares, and there's no easy pause button to go do it, but that's where these people can step in. So I usually encourage them, one, if you're in the hospital, bring socks, people will love you. And two, try and pick out something specific that you can go do for someone, and it's much easier for them to say yes than to try and think of something themselves.
If I can jump in on that, I love those points, and I think when that doesn't work and we're left with that moment of how can I help you, and you think this is one more thing for me to do is to tell you how to help me. I keep going to one sheets, but this is another one sheet I would have at the ready. Rather than say, oh, thank you, Janice, for asking how you can help me, here's how you can help me. If I had a list on my blog or on a piece of paper that I'm ready to hand out at any moment's notice, here are some things I recurrently, chronically need, or my family needs. And so that way, it's not, Janice isn't gonna come mow my lawn, but mowing the lawn is still on the list, right? But the person who does feel like they can mow your lawn sees that, and that's what each person finds what they can do. And it goes to Bret's point that these are very specific things. They're not, let me know someday, somehow, how I can help. Like, no, on Tuesdays, I need somebody to pick up my kid. And if you have that at the ready, it's much easier than trying to come up with it in the moment.
Great point.
Bret, you said something about the socks came from someone that had probably been there before, and after our NICU experience, one of my son's first grade classmates had a little brother diagnosed with a rare condition that he was going to be in the hospital for the better part of the school year. And so I did not know the family at all, and I called the mom and I said, we're going to bring your daughter home after school every day. I'll make her lunch for the next day. That way you and your husband can go to visiting hours. Because that for us was a big trauma. We could never go together because we had other children. And so we did this, and this little girl, Sophia, was at our house, and my son asked me why. And I tried to explain all the moral and good reasons, and he said, but why is it a girl that you picked? Oh, I hadn't thought about that part. But that's true. And I think for all of us, we can, we have shared experiences, and so that's really powerful. Daniel, one of the ideas that came up in the prep call was this idea of a training party, particularly for families with medically complex conditions that require feeding tubes and things that are not, part of somebody's everyday life who might be able to help the caregiver. What are your thoughts on that?
Yeah, it's definitely something in hindsight I wish we had done. I learned the hard way, I guess. So we always, I think a lot of us hear the first advice, which is excellent advice, and I give it, find your people, right? Well, find your people, yes, but then find more of them. You're going to need more of them because you will exhaust some of the resources, right? And we know how, if you want to, in our case, we couldn't have someone come babysit Lucas for an hour or however long without 2 or 3 hours of training that person. And then you do the cost-benefit analysis and you say, it's not worth it. I'm not going to get a babysitter because, forget it. Well, what if you brought in 5 friends or 6 or 7 friends at once and had a training party and said, all of you are now going to know the care needs and how to do an overnight with my son. And then when one of them's not available or one of them burns out or one of them says, I'll never do that again, you've got backups and you've reduced the amount of time it took you to train them. So that's my idea for a training party.
I think that's fantastic. Claudia said this morning, and I mean, 3 cheers to Claudia for the film we had a chance to see. She said, "We feel isolated and people don't know how to help us." Bridgette, when you think about that statement coming, it's kind of a universal caregiver concern. What have you seen in your work with families that helps with that actual isolation that you mentioned earlier as well?
Yeah, well, I think another piece of what she shared, that documentary is beautiful, about, finding your people at the end. I think that's really important. I also want to really normalize that for some folks, that process is really scary. So we actually see in Wellcast and that's the name of our trial. I'll be outside later. We have a booth that's stuck somewhere between the Panhandle and here, but it'll be set up later today. But one of the parts of Wellcast that I love is that we designed it to be open to any family who has a rare disorder associated with intellectual disability. And so we get a lot of families coming in who have never had a community. They have, ultra rare conditions. And some of those families love the experience. For some folks, we're putting them in individual treatments, some are in groups, some are in peer coaching. We're trying to see which of these things is the best. So people are getting all sorts of different types of support programs. But what we did notice is for some people, stepping into that community, stepping into those group treatments in particular, was really scary because they were suddenly hearing a lot of different information that, depending on where they were in their caregiving journey, could feel like too much. And then they felt like kind of what psychologists might call flooded, where you have a ton of experiences coming at you at once and you might have kind of panic reactions or you might shut down. That's a really normal experience. So as you're trying to find your community, I just want to mention that if you feel that, that's not an abnormal experience. That can be a normal experience. That can also be a sign that maybe your community needs to be a therapist or a friend, and kind of starting slow, starting kind of processing what you're going through in your journey as you step out into these big, beautiful, supportive patient organizations that are so, so excited to welcome you. If you're not feeling ready for that can be okay. So absolutely find your people. I love these ideas. There's so many good structural ideas. If you're, as the psychologist up here, if those things feel scary to you, the first step to finding your community might be finding a little bit more comfort with where you are in your journey, and that can be something that is an important first step for a lot of caregivers.
Thank you. Bret, you tell us a little bit about your family, and specifically where we're going is caregiving plus parenting, and how that you think about that.
Yeah, so I have 3 kids. 2 of them have been impacted by rare disease, and in their case, it was kind of severe and acute instances, totally unrelated. So 2 boys, 2 1-month stints in ICU, 2 kind of treatments and management plans afterwards. And I think, again, to that context switching, you kind of have to mentally do that as well, the difference between being a parent and a caregiver in the activities that you take on and things that you talk about and things that you approach. And so what I try to do to myself is just remind myself to be present and then kind of which situation if I'm in. And that's actually like visualizing myself like being a nurse in certain places versus I need to be a parent now and talk to it in a certain way. And then, as much as we focus on being a caregiver, right, I'm sure I have some work to do as a parent too. So it's trying to kind of balance of, okay, if I felt confident now that I'm doing what I need to do caregiving, that doesn't mean that there aren't other places that I need to grow and really being mindful and respectful of that as I'm going through, because it can be really consuming to get really narrowed in on one area of expertise, realizing I have an obligation to my kids to be a good dad as well.
We all think he's a great dad, right?
Oh, thanks.
Daniel, from your perspective, when you look back after your trajectory of caregiving, what's the biggest lesson you learned for yourself?
I guess it's related to find the time, which I know sounds so easy to do, and yet it's so hard to do. So I was the type that, and probably a lot of us felt constant vigilance was required, and constant right there tells you it's probably impossible. And we were lucky in some ways. We had a full-time nurse in the house, and that helped. But even so, Jesse's here, and I talked to her, that there was this horrible moment of feeling I couldn't even spend time in my backyard because it wasn't easy to get Lucas into the backyard. So Lucas was almost always in the house. And so we never enjoyed outdoors. because it was too much of a hassle. I mean, sometimes we bring them out of the house, but it was too much of a hassle to easily, conveniently do that. So then I noticed, even after Lucas passed and it wasn't a factor in our lives, I'd have this instinct of, I've spent too much time outdoors. I need to be in the house. So it was all consuming, and I knew enough to try to not let it be. And back to some of our earlier points, like how do you find the time? I realized I could sort of double purpose some things. I was in the habit of listening to a 12-minute news podcast. And I was never a workout person. But like, well, if I take those same 12 minutes, still listen to the podcast, but do a workout, I haven't lost any time. And then another friend told me, therapist friend, told me, you need to be getting outside, even if it's cold winter. I'm like, oh, even if it's cold winter. So now I'm in the habit of a daily walk for about an hour, and I try to do it no matter how cold it is. But I think that's probably the biggest thing is the needs are almost infinite, and you feel the burden to meet them. And it feels very hard, and you feel guilty if you do any less. But you have to dial yourself back from caregiving once in a while. And it helps, I think, we have another panel on the sibling experience, but in a way, my son in typical health kept us in check a little bit. Like you were saying, Bret, you also have to be a parent. You can't just be the caregiver. And that was a bit of a reminder of, wait, what would I do for my other son? That's not caregiving, that's parenting. And let's get out of the house, and let's do typical things. And so time, I guess it all boils down to a crash course in time management that you never thought you would need.
Time management with a little bit of a conscious thought process on helping yourself too, like being able to add that has to be on that list. We'd like to open it up for questions or comments and see what anybody wants to ask the panel. So if there's anyone in the room that wants to start.
I guess I could be the runner of the mic.
Hi, my name's Sunny. My younger brother Tristan is 28 and lives with a rare disease, so I'm definitely going to the sibling workshop, but come at it from a caregiver, but my parents are primary caregivers as well. And two things that you guys spoke about that really resonated was the one about keeping a list of needs. In my professional role at Help Hope Live, we have a table, but we have a client that I'm friends with that I know they keep an Amazon wish list of things that her husband needs in his everyday life, so that when people ask that question of what can they do, their friends and family just know to go to that Amazon wish list all the time. And I think it's just such a smart, and I think to add to the everyday like household chores and all is just a really smart idea of that. So I thought that really resonated. But one thing in the caregiving plus parenting, I thought that was interesting to put those two together like that, because in what I see with my parents, my parents are in their early 70s, so technically they're retired. And when it's hard for me, because I feel like I technically get this question more so since I'm the one that's out and about more than they are, is people ask me all the time how my dad's retirement is going. And I laugh at them, and my dad will laugh and say, well, what retirement? And my mom says now that she's probably busier than she's ever been when she was a VP at our YMCA. And so that's always kind of hard too, because I'm like, outside people, it's, how do you think he has a retirement? I don't know. I always wrestle with that a bit of how people, it's hard in the outside world when people can look at us or even them and see like, they're not going out all the time. What do you think they're doing? How's your retirement? But that's just something that's been coming up more and more since they are of retirement age. But he doesn't get a retirement. There is, and that dialing back from caregiving is, having him try to do that is near impossible. But he is my brother's full-time caregiver, so it is. But that, how's your retirement going, is always just kind of a funny question. And I kind of look back at the person and say, what do you think they're doing every day? But those are just a couple things that really resonated, so thank you.
Thank you for sharing, and the Amazon wish list is a great idea. Thank you.
Kind of similar along the parenting and caregiving. I'm a social worker for a nonprofit that works with rare disease families, and then I have 2 children with spinal muscular atrophy, and when my daughter had a spinal fusion surgery a couple years ago, it was the first time that she needed a lot more hands-on medical care as opposed to like day-to-day, moving about or getting something from the cupboard or whatnot. And it was interesting. She actually, this is going to sound really weird, but she actually started. My name is Danny, and she started. One day she said, "Diane," and I'm like, "Who is Diane?" And she's like, "I'm gonna call you Diane when I need like medical help, Mom." And it was such it was kind of funny. We like laughed about it, and my husband's name is Thompson, and Terrence, and she's like, "I'm gonna call him Thompson," so you can see what she was doing here. But we started talking about it, and what she said was, "This is so different than what you have always done for me." And she was totally right, and it gave us that opportunity to talk about how it is for us as parents to be a caregiver, and what are those kind of healthy boundaries we can put in place so that she can ask me for things like I'm a nurse or an aide, and she doesn't need to feel bad about it. I'm Diane in that role. She can just ask, and I will help her with whatever she needs. But it was a good conversation to have with my kids as they're getting older, where like there are times when I'm Danny, when I'm Mom, that's when we're like snuggling and we're hanging out and we're watching TV and we're doing whatever they like to do. But then when she needs something different, she understands that that's a different role, and not all parents are providing that. And I feel like that was a really helpful conversation to have and to start having with our kids as they get older. And I just wonder if you have any experience with that and how you talk through these things with our children as they become, my daughter's 13 now, so as they become young adults and into adulthood, so that sometimes tricky caregiver child role that can get real messy and very unhealthy boundaries sometimes can be more supported and kind of make that transition a little bit better so that we can have a good relationship at all of their ages.
Bret, any thoughts from you? Danny, thank you for sharing. That's an amazing story.
My initial thought is I love it, and like how selfish of me to be worried about me playing both roles and not thinking about my child and how they go respond to me. So
what would your caregiver name be?
we might. Yeah. That's a great question. But I love the concept because, when I talk about switching roles, I do think I probably take on a more serious tone when I'm in the caregiver, right? We're gonna do this. We're gonna do it this way. It's gonna be administered this way. And that's only part of my personality and who I am. So I don't know if I have anything to add on to it. I love the idea of another name to kind of really differentiate that. And like you said, make it a safe place to go ask questions that may be more caregiver focused than parent focused. I think it's a great idea.
What a beautiful story. And it reminds me, one of the activities that we do in some of our programs in Wellcast is talk a lot about identity, and this identity that you're describing as a caregiver is one of many that all of you have, right? Including social and cultural identities that are important to you. And one exercise that some people find helpful in our group is to kind of write out all these identities and circle the ones that really matter to you. And just think, even in the constraints in your daily life, how can you feed that identity? How can you honor that identity? It might be, just joining some Facebook groups focused on a part of you that matters to you outside of just your identity as a caregiver. It might be prioritizing attending one event a year that is related to kind of a cultural or social identity that is outside of your identity as a caregiver. But a first step is often just mapping, outside of this very central, pressing, important, beautiful role that all caregivers play, what else matters? And then what are the teeniest, tiniest ways that you can honor that part of yourself too? So I love how you're talking about separating out these different roles, even with names. I think it's a really creative and beautiful way to talk about it.
I think any of us who knows rare disease families or in a rare disease family, it's these kids that just blow our minds. And your daughter to even have the clarity to say, here's what we're going to do and here's why is pretty special. So
Very cool.
You're a good mom.
Hello, everyone. So I have a little advice for not only the moms or the parents with children, but the spouses. So my spouse has a rare disease. She's post-transplant, 6 years now, but pre-transplant, we lived at the hospital towards the end when the transplant needed to happen. And what we did was kind of like what you teach the kids in case of an emergency, you pack an emergency bag. So we would pack the emergency bag, mainly my snacks, because I'm always the hungry one. And the name that we use is Panda. It's for you. And what we would do is treat it like date night. So rather than have to constantly explain to our friends, we're at the hospital again, and make it like a whole big deal, we would say, we're at date night, we'll check on you tomorrow. And people in the end understood, oh wow, they're at the hospital, we'll check on them the next day. We had the bag ready with the emergency stuff, and friends started to understand. And also with the note for the Amazon, I agree with that as well. What we did was I just put out a list of, hi, I'm hungry, this is what we need. And send it out. Because everybody knows I like to eat because I'm a stress eater, so it became a thing. Rather than have to go through Amazon, it was like, hi. Same as when someone passes away and you're like, oh, what could I do for you? A coworker taught me that, and she wrote it, and people at first thought it was abrasive. But then when you thought about it, she said, these are the things I need. My husband just passed away, and it was a line list of everything. No one reached out. Everyone just sent her whatever she needed. So,
How's your wife doing today?
she's amazing. Date nights have not happened. She's kind of in remission. Well, those date nights anyway. We have good date nights now. But yes, so I'd say just have a bag ready. Keep the snacks, change them out every 2 weeks, 3 months, or whatever you need to do, and treat it like a date and just kind of go into it. This is for the caregivers, though. Go into it with like a positive attitude, like, you know what, I get some time off. She'll be in surgery with the doctors, and I'll be sitting there watching the TV in the room.
Thank you for sharing.
Yeah, I think just to add on to
Right
that,
behind you,
it feels like a key theme here is when, there's so much in this space that we can't control, but when you can put a name on it, right, you can kind of control what it means to you, and it's personalized to you, and I defer to Bridgette for the psychology of it all, but it makes it really powerful and intangible, and whether that's the different personas that you have or different activities that you have, and I just think that's such a powerful thing with everything else going on, to put a name to it. You control what it means to you, how it goes on, and how it executes, and that can be really powerful.
Hi, I'm a rare mom, and I think a lot about the impact on a marriage and how inevitably with really complex kids, there tends to be a default primary caregiver in a relationship. And I professionally also advise other families and caregivers on how to take care of themselves, and I often feel like a fraud because I feel like I'm really privileged to be able to take care of myself the way I do because of my income and my socioeconomic status, my race even, my partner, his degree, my degree. We have all of these factors. We have a really beautiful marriage. We have access to therapy. And so I just wondered if you had insight and advice on like how those dynamics have played out for those of you who are partnered, and if you have advice for caring for the other caregiver and caring for each other within the context of that really complex and dynamic relationship.
Yeah, I can go first as a part of the equation, not the full thing. So using technology, again, can be really helpful in terms of sharing information and getting people to feel confident up to speed when they're not always there, because quite often one person or the other can be there. This would be a plug for mejo and what we go do. But having it all centralized in one spot, my wife and I tend to flip-flop on who goes to different appointments. And so knowing that we all have a centralized place where we can be up to speed, where we don't have to spend the time to prepare because it's right there and I can just go access what we need, has been really helpful in terms of the caregiving activity. I think in terms of a relationship, and we've talked about this a lot, right? Time is probably our greatest resource. How do you go, what models do you use to go bank time and go do things? And you have to make time for that other partner because we talk a lot about with our community, us as caregivers have such a direct impact on the loved one that we're caregiving. If we're not at our best, how could we expect our caregiving to be at our best? And how could we expect them to be at our best? And when you're in a relationship, making sure that you're doing the things that you need to continue that relationship in a positive way is all part of that. And so whether you need to write yourself a script for, just like someone needs medication, I need to go spend time with my partner because I know at the end of the day, the outcomes of that are going to be better for everyone. So those are a few thoughts. I'm sure the rest of the group can add more.
Daniel, what about you?
I just got to say we were terrible at it. We were. Everybody says, well, make time for yourselves, have a date night, don't let that go. We let that go. We just let it go. And then, as I mentioned, we had a nurse, so we had a little bit of privilege and a little flexibility to the caregiving schedule. And we'd say to her, okay, it's Friday night. Can you stay a little later? We're going to go out late. And we're going to be back as late as 10:30. Is that okay? And she's always like, yes, fine. We'd be back at 7:30. Partly because we were worried. We had to get home. We couldn't let ourselves detach. And partly because we'd run out of things to talk about. If it's not talking about the kid and the caregiving, we didn't know what to. So we're a really bad example.
Yeah, I guess I can speak to the research side of this. We have done couples therapy through WellCast, which has been really interesting. Functional, very difficult to schedule was actually the main barrier to that, was getting both partners available, even via telehealth, to meet at the same time with a provider. One thing that I will mention that I've noticed over the years of this project is that sometimes, we just went through the Olympics and you watch these beautiful athletes do these amazing skills that they practiced and practiced and practiced. And I think when you're thrown into a really stressful situation, sometimes even if you have some skills, they're just not at the level that you need to handle that situation. So normalizing that things like communication, which sounds like such a throwaway piece to this, there are actual skills within communication, like reflective listening, that you can practice and practice and practice, so that when you have that 10-second of eye contact and communication with your partner, you can help them feel seen and vice versa. I always tell people you can practice this while watching reality TV at night. Watch a couple feud on The Bachelor or something, and you can practice saying, what I'm hearing you say is X, Y, Z. So these are, things that you can practice in real time. And again, I always want to put in a plug for, even if you don't have time for couples therapy or the resources that are, of course, required for these types of things, practicing your own communication skills in a partnership can be a really kind of accessible place to start, and then you can practice it while you're in bed at 7 at night, watching your reality TV.
So we have one area, there's a question in the back, Daniel, that we haven't touched on, Bret, that I wondered if you could comment on. For those of us who want to be there for our friends who are caregivers, we hear the word guilt a lot. Oh, I feel guilty, I won't leave him, or I feel guilty that I'm not going to be at home. How do you think about that part of the context of caregiving and being able to give yourself time to do other things?
Yeah, I think it's, again, goes back to a little bit of, if I'm the best version of myself, then I can give the best version of myself. And the reality is that some of those things are, and Bridgette talks about identity, and I think it's very fascinating. So part of that was part of my identity before I had kids and was a caregiver, and part of it's still part of my identity now. And while the amount of time and effort and thought that I dedicated to it may sway up and down, that's part of who I am. And so I need to be able to retain that in order to be my best self, and knowing that will allow me to go do other things. Again, time management is hard and challenging, and you have to find what works for you. But again, these trade-offs that I talked about earlier, and banking time, that allows me to go do some of these things. Whenever there's an opportunity, how do I find a better way to do it? We talked a little bit about skill building. My business partner, Ryan, has a good example, too, of different things where, you got a growth hormone that you're giving daily. You go advocate, you get to one that maybe you can give weekly. All of a sudden, you look at those time savings adding up. It's got to take kind of something from within to say, okay, this is where I can go manufacture more time so that I can go do other things, so that I can go help myself, so that I can go help others. And it's really trying to find that from within and really going and pushing for that, I would say.
The question of guilt, too, I think guilt is a feeling that you're doing something wrong, or you're breaking a societal norm, and in today's society, families are really isolated, and that hasn't always been the case historically. People used to be much more embedded in their communities than we are now. And so I do think, if you're feeling guilty for taking time for yourself, thinking, what are the rules that I think I'm violating right now? Is it that, the mom should always be present, or that children's needs come first? And then see if you can think of reasons that maybe you're not wrong. Maybe it is important that you put on your life mask right before supporting others. So, playing with that guilt and figuring out where that's coming from can be an important place to start, so that you feel good about the decision to take care of yourself, even if that specific time is being taken from another need.
Hi, I'm Suzanne Edison. I'm a mental health coordinator for the CareJM Foundation. I'm also a rare mom, and I have a background as a therapist, but I will say that when my child was first diagnosed, I know I needed support even as a therapist, and it was very hard to find. And one of the things about guilt, which is really what I wanted to speak to about, is that taking time, and I think it's maybe more true for women, but not necessarily, that we feel more guilty if we're not doing everything, taking care of everybody else first. And so the whole issue of, I think everybody's discussed here about making time for yourself is important so that you refill your well. But I wanted to say really about guilt per se was that it took me a while to understand why my guilt was not actually helpful, because I thought if I had something to pin it on, to blame, or if something I could do to make it better, then I could fix it, right? So the guilt was about the fact that really I was helpless and I couldn't do anything to fix it. So once I got a hold of that, then every time I started to feel guilty, I would say, what can you do in this moment that will be helpful, and what can't you do, that you're not going to be able to fix? So that, for me, that was a way of, the guilt still came up for a very long time, but it was an opportunity to say, what can I do? Maybe there's nothing to do except to breathe and to let myself be here and to just tolerate the feelings of helplessness, and then I can move on.
Really great panel. Appreciate the discussion. Real quick question, given what you said earlier, which I really appreciate you bringing to the space. I'm a rare disease dad as well. But I wonder, Bridgette, if the data that you've collected, that robust data that you've collected, whether or not you've taken race into account, and whether you've noticed a difference in how that being a parent of color in a racially structured society adds another level of stress, and whether or not you can actually find the time to do the things that are necessary.
Yeah, and I'll apologize when the door opened and the speakers aren't pointed at us. Could somebody summarize the question? I couldn't hear it. Sorry,
The data that you've collected, whether or not you've been able to disaggregate that data by race, and
Okay.
to see whether or not that shows up in the different levels of care that parents can provide.
And I'd add to that gender too.
Yeah, sure. We're definitely looking at different demographic factors, including race. And Project Wellcast actually has an entire support program that's for Black caregivers that was designed to address issues of potential discrimination and issues, trusting medical providers. And that's out of Georgia State, Aisha Metzger's work. I think it absolutely matters. I think it matters in terms of how folks also engage with the rare disease communities, because obviously it takes a lot of kind of privilege and comfort to come together in these spaces. So we're not at the point in the trial yet where we have enough subsamples, and we haven't done the full analysis of whether these different support programs are working better or worse for folks from different demographic groups. But I will say that I think that there are extra barriers that even telehealth won't solve for families who are racial minorities and who have extra barriers. And so, I think when we started seeing telehealth really take off, and I've been a telehealth researcher since 2016, so before the pandemic, I think everybody thought, oh, this will solve, issues of barriers and access, and it doesn't. And so I think we have to continue to be really persistent and creative. And I really think it will require designing supports for families that really are designed around their culture and their needs. Right now, we take a lot of treatments that were not designed for minority communities and that don't kind of center the values of those communities. So right now, we're trying to see what does work that's already available. I think the next step will be to build out this part of what we're doing and what others are starting to do of how do we start over and design programs that are actually designed around these cultural groups. I would love to hear more from people too on that topic if you want to come by and chat with me.
I want to say thank you guys for all the information and insight on stuff. One thing I've struggled with is I have two daughters. My youngest is my rare. She's 14. My oldest is 21, and actually she just started working as a nurse at the PICU here at Mercy. I think her sisters guided her in that decision. But one thing with them growing up is I missed a lot of stuff for my oldest. And I carry that guilt. I still carry that guilt every day. And my oldest had to grow up quickly. And what is ways for me as my youngest daughter's caregiver to, I don't know what word to use, but deal with that guilt I have, but also for other families, what is something that they can do to help with that feeling of that when you have a situation where only one parent can go to all the appointments, one parent has to do everything because the other one is the working parent. Because in our situation, I was not able to work due to my daughter's health. And my husband is a farmer, so he can't just take off and leave the crops and the animals and all that kind of stuff. What is one thing you guys would suggest for families?
So I'm still having trouble hearing. What was the
So
feedback?
really, I think first of all, you're doing everything right, and so don't be so hard on yourself. We actually initiated a sibling survey last year, run externally, and one of the biggest insights that came back is that the siblings of children with rare diseases thought their parents were amazing and should lean on them more. So there really is, and then you look at your daughter's a nurse in the PICU. I mean, talk about amazing. So, at the risk of oversimplification, focus on that. You've done everything right, and that's amazing. And there isn't a mom in this room that's a perfect mom. None of us are. So kudos to you. But I think it's a really big topic that as a group, we should think about how do we get more information and more data and more resources for exactly the question you've asked. We're at the end of time. Two things, we'll add my mejo to this list of resources. So I can't read that fine print, but I don't think it's there. So Bret and Ryan mentioned it a couple times. We'll make sure everyone has access to that link. And Bret, I'm going to put you on the spot. For those of us who love and care about a caregiver, what do you want us to know about the joy of caregiving?
That's a great question. We talk about joy a lot, actually, and I think it's, sometimes we're so focused on what's going on with caregiving, we don't recognize that there are all kinds of big things that shape our lives, and this just happens to be one of them. And so I think, unequivocally, there's so much you learn about yourself and about others and going through it. And just as you would some other life event or life thing, if you live on a farm or if you live near a stream, right, that's going to dictate what you go do and how you go look at life. This is just something that happens to be imminent and going on in our lives. And so I think the extra value and knowledge and understanding for myself personally has been joyful. And then, what that's translated to with my family and how they think about others. You can see it when someone comes in the room that maybe needs some extra help, and it's your kids that go take the first step to go help them. Those things are really powerful.
Thank you so much. Bridgette, thank you for the work you're doing. Everyone's in this together. Bret, thank you for sharing so much of your personal story and changing lives. And Daniel, thank you.